I am very pleased to introduce Erin Murphy this morning. Erin is a registered nurse and has served as a Minnesota State Representative from St. Paul in District 64A for the past decade, and is running for governor in 2018. On June 1st of this year, Erin earned the endorsement of the Democratic Farm Labor Party. She is the daughter of a union auto worker growing up in Janesville, Wisconsin, hotspot, and started her career as a nurse in a small community. She moved to Minnesota to work as a surgical nurse on a transplant team at the University of Minnesota Hospital, and later served as the executive director of the Minnesota Nurses Association. Today, she teaches in the nursing program at St. Catherine's University. With her nursing practice rooted in advocacy, Erin knows a healthy state is one in which all Minnesotans have access to health care, public education, and economic opportunity. She fought for those values at the legislature, where she helped pass marriage equality, increase the minimum wage, and fund universal all-day, everyday kindergarten. Now, as a candidate for governor, Erin is fighting for a bright future for every Minnesotan, including a Minnesota health plan that will allow every resident to get the care they need when they need it. And let me just say, it will be a wonderful day when we can say that nurses are really, truly running the world. So, Erin, come on up. Thank you. Hey.
Good morning. Good morning. This is way better than coffee, I'll tell you that. So good morning, everybody. How are you? Are you ready? Are you ready to make the change that we believe in? Are you ready to make the change we need to make in Minnesota and in this nation to make sure that everyone has health care they can count on, right? I am thrilled to be with you today. It is my deep honor, and I can't tell you what a moment in time we are existing in right now. I have been a registered nurse since 1985. I have practiced nursing in many ways, including in public policy and advocacy. And I have worked for most of these years in some form or fashion in healthcare, in organizing, in creating access and coverage for people. And I have not, in my 26 years of work, experienced what we're experiencing right now across the country in terms of an appetite and a change on the part of people, citizens, Americans, Minnesotans, and a demand for action on this issue. And it is because of the hard work of people in this room for many, many years, pushing the agenda, pushing the agenda, pushing the agenda, and the realization on the part of people across the country that the system that we have in place right now is not working for the people. It is working for the industry. It is working for the moneyed interests. They are the ones that are benefiting from what is a very broken system. And I will say this over and over again in the course of this campaign and as we go forward. They are powerful interests. There is no doubt about that. We know them. They inhabit the walls of the Capitol. Doran Schranz, a woman I know here, says they're like wallpaper. And they are. But we are more powerful than they are. And when we embrace that power, use our smart organizing skills that come out of years and years of work in labor and in progressive movements, and tell the stories of what people are experiencing at the hands of a system that is more interested in its financial well-being than the care of the people, we will win in this argument. And I am grateful to be a part of that. So I want to tell you, I went to work for the Minnesota Nurses Association a number of years ago, many more years than I will be able to count. And I did because I was practicing nursing and taking care of individuals, and you could see in that practice what was happening to people outside the walls of the hospital. And I kept thinking, what do I do about what's happening out here that is bringing people back to the hospital again? How do we break that cycle? How do we invest in health promotion and prevention and well-being in such a way that people aren't sick all the time and back in the hospital. And I knew about the Minnesota Nurses Association when I was working in a rural hospital in Wisconsin, and I knew that they had organizers and lobbyists, and I thought, that's the job that I want. I want that job for the rest of my life. That would be so cool, because I grew up in a family that taught me about politics. They taught me that politics was powerful, that it was important, and that when we focus it and use it to improve the lives of people, we can make real progress for people. So I set my sights on going to work for the nurses, and I did. And the first work that I did there was as an organizer when we passed Minnesota Care. That's 26 years ago here in the state of Minnesota. And I will tell you that nurses were instrumental in that work, and there were many provider groups that were not all that interested in Minnesota Care because they were worried about what it would mean for their reimbursement, for their control, their autonomy in the care delivery system. But the nurses knew how important it was that we make sure that people who work for a living, who didn't have access to coverage through work, got it. And there are people in this room today, Eileen Weber, and other nurses who were a part of that then and are part of this movement today, who understand how important the well-being of our state, the state's economy, our future rests in the health of people. And that's what brought nurses to that fight, and the nurses were beautiful in that experience. So 26 years now, we have been chipping away, moving in a direction, expanding coverage for people. And I want to call out John Marty. Has John Marty already spoken to this group? Okay, Senator John Marty. Senator John Marty has been the leader on the Minnesota Health Plan and carving forward the path that we're going to use here in the state of Minnesota to enact single-payer health care. And if you haven't yet, you should make sure and talk with John Marty. He is brilliant. He has been courageous, and he has set the path for us here in the state of Minnesota. And I believe, and I keep saying this to the people here in the state, we're going to lead the nation again like we did 26 years ago and make this guarantee real in the state of Minnesota. Thank you, John Marty, for all of that work, and thank you for letting me talk about the Minnesota Health Plan on the campaign trail. It's really important. We have moved here in many, many ways and expanded coverage, but we know this, right? Coverage is not the answer by itself. And I was happy in my work with the Minnesota Nurses Association. In 2004, my mom, Kathleen, who loved politics, decided she was finally going to campaign. She lived in Janesville, Wisconsin. I went to the same high school as Paul Ryan. Aren't you glad he's leaving office? I'm so glad he's leaving office. Anyhow, that's right. That's right. My mom decided that year she was going to campaign because she was frustrated with the war in the Middle East, and she did a lot of door knocking that year. And you'll remember that John Kerry was running for president, and he lost that election. And at the end of that election, she found out that she had lung cancer. My mom was a smoker, so was my dad. My dad grew up on a tobacco farm in southern Wisconsin. She was really worried, and the nurses, the MNA, made sure that I was able to go home and take care of my mom for the next 11 months of her life. They said, if you need to, go. I was their executive director. I had kind of a big job at the MNA. And they made sure that my job was safe. That's paid family leave. We need to make sure we do that for people all over the state as well, right? Now, my parents had worked hard. My dad was a union worker. He built cars for a living in Janesville. My mom, when I was old enough to take care of my siblings, went back to work. And she worked at a canning factory. She worked at the grocery store behind our house. She cleaned houses for a living. My parents had really good health care coverage. And they had Medicare. And they had to fight with the insurance companies to get the care she needed when she was really sick. And I'm telling you what, it pissed me off. No big surprise. For all those years that I had been working to make sure people had access to coverage, I watched, just like people do all across the country, when you're really sick, the moneyed interests say, you don't need that treatment. You don't need that. They're going to judge over the physician. And luckily, my mom's doc went to bat for her, and she got the care she needed. And I'm a nurse, and I have a brother who's a nurse, and I have an aunt who's a nurse, and we, went to town as well. She got the care she needed. At her funeral, her sister said, you should go do something about that. And that is why I ran for office. And I have been in office for 12 years, and I have watched us make real progress, but never have I seen in my years in public office and before that the appetite that people have right now for the change that we need to make in the wake of the Affordable Care Act, as we watch the market position itself to take advantage of the new law. We watch drug prices go up, deductibles that are out of reach, premiums that people can't pay for. All across the state of Minnesota, people are really, really worried about their own financial security and their own health. And that means that we can bring a real solution. There was a nurse that I talked to at an event, maybe 6 weeks or so ago. I'm going to swear right now, so forgive me for that. And he said, I really like your idea about single-payer health care, but how do you explain to people that it's not batshit crazy? That was his words. And I said to him, what we're doing right now is batshit crazy. Right? That's right. When the moneyed interests are ahead of the well-being of the people, that's wrong. And as a nurse, as an elected official, as the next governor for the state of Minnesota, that's not going to be okay anymore. I was in Gibbon, Minnesota earlier this week talking with a group of people about their experiences in farming, small farming. A group of people from the western part of the state. And we talked a lot about access to land. We talked about the difficulty as small vegetable farmers getting access to markets. And then we talked about healthcare. Healthcare is an issue in greater Minnesota, in rural Minnesota. It is an issue for families all across the state of Minnesota. It is actually really an issue for employers. My husband's a small business owner. It is an issue for small business owners and employers. And we're just not talking about it in the right way around us. But on the campaign trail, as I talk about single-payer health care, and that's what I say, people say don't talk about single-payer, but I do. All across the state of Minnesota, people are excited about the change that we need to make. They are excited about it. There is a young man that I want to tell you about, and maybe you've already heard about him, Alec Smith. You know Alec Smith? So Alec Smith's dad told me this story about his son, the loss of his son, 26 years old, moving off of his parents' insurance because he'd aged out, finding his own coverage. He worked full-time. He was an insulin-dependent diabetic. He couldn't find coverage that he could afford. And so he started rationing his medication, his insulin. Now, insulin, when I was practicing nursing, was very inexpensive. Insulin is not inexpensive anymore, right? People are making money off the production of insulin, a drug that has been around for forever. Alec couldn't afford his insulin. He was rationing his insulin. He lost his life at 26 years old. Sometimes my colleagues will say, a bridge should not fall down. We had a bridge fall down here in the state of Minnesota. A bridge should not fall down. A 26-year-old should not lose his life because he can't afford his medication in this, one of the wealthiest nations in the world. Now is our time. Now is our time. And when I think about the politics of right now, there are people demanding urgent action on the issues that they are facing, and this is one of them. And when we stand up boldly for what we believe in, and we stand up for the people, when we stand up for young people and for farmers, when we stand up for nurses and teachers, when we stand up for refugees and immigrants, when we stand up for young kids and elders, our cherished elders, when we stand together and we say, here is what we can accomplish, using a kind of politics that improves lives, that focuses on us again, that is not about just beating the other side, but instead invests in us. That is how we make progress. And all across the state of Minnesota, that is what's working. That's how we earn the endorsement. That's how we're going to win this race. And I will tell you this, I need your help and your partnership, because when we get there, the next part of our fight is going to be exceptionally challenging. That's okay. We already know that. We are more powerful than those interests. We can stand up by telling a story, by organizing and working hard. That is the only way forward. And you have in me a partner. I will be that partner. I will lead with you on this fight to make sure that people have health care they can count on, especially people who are sick. I am grateful to be with you today. I'm grateful that you're here and for your leadership. And know this is something we will do together. This is how we build a bright future for the people of Minnesota and the people of America. I am fired up, and I hope you are too. Are you ready? Are you ready to lead? All right. Thank you very much for having me. Thank you very much for your hard work. Thank you very much for caring so much for people. Thank you. Thank you. Thank you.